coming now. All right, we're coming there. Cool. All right, guys. Thank you very much for joining. Everyone's sort of logging in now, so I'm just going to give it a couple of minutes. Thanks for attending this. It's been really well subscribed to. We have attendees, obviously from Australia, but we've actually Italian people joining us, UK, Ireland, and also Mexico. So we have some vets that from Mexico that are logging into this. They're getting up at 4 a.m. to watch it live, even though we do record it. So I do appreciate them joining us. So it's really quite an honor for you guys to attend. So I'm going to get started now. Just a quick recap. If you want to ask a question, use the Q&A button, and we will stop at periods to answer questions. But if there's something comes up that's relevant as we're going, I will answer the question as we go. So this evening, I'm really thankful to be joined by Dr. Ian Fulton from the Ballarat Veterinary Practice. Ian's been a practitioner for a long time and is a partner at Ballarat Vet Practice. Ballarat Vet Practice are one of the leading diagnostic imaging clinics plus full referral services in Victoria. I'm not sure the number of vets they've got up to now, but they do have 3 surgeons on board and they're kept very busy. So at their clinic, they're the first clinic in Victoria to add standing MRI to their repertoire along with scintigraphy. So I've invited Ian along tonight to talk about those MRI and scintigraphy. But first of all, we're going to run through the most common things that you'll see out in the field that I'll use: ultrasound, endoscopy, and x-ray as well, and where we'll use it and the limitations of it, because there are limitations to every piece of equipment we use. And we as vets often have to think about that, but you guys as horse owners need to understand what we're thinking. Sometimes we're not very good at verbalizing that. So, first point, in the last 15 years, there's been an enormous growth in diagnostic imaging. When I started veterinary practice 19 years ago, we were still using x-ray films and generators and taking them back to the clinic and then giving you a ring later and saying we're going to have to come back. Now that's all changed. We're mobile. Mobility's there, and it's great for you guys. So this x-ray machine here, while I didn't quite start with this machine, my first digital portable x-ray machine I used was about 15 kilos in weight, and I almost needed to go to the physio most weeks. But now we've got digital x-ray, digital ultrasound, and video endoscopy that's really portable. So what's the advantage for you guys? Well, we can get second opinions. So I know Ian will testament to, I'll often send him x-rays if I want an opinion or a surgical opinion, and we'll get answers in sometimes in minutes, sometimes in hours, depending on whether Ian's at surgery or he's busy. So that's great. Also pre-purchases interstate, overseas, that's absolutely fabulous. And also you guys, you have a record. So many times I see you, it might be first time I've seen you, and you've got previous x-rays images. That's just fabulous. And keeping those on file is really good. We freely provide them, and I know Ballarat Vet Practice do the same. They send all your images back to me and I've got them stored as well. So we're going to start with endoscopy. Something I've added, we've always had an endoscope, but we've now got video endoscopy. It goes by my iPad, and that's just great for monitoring things. So maybe not something you've come across, but we are seeing more and more respiratory tract problems with performance horses. So this horse here presented as coughing, and you'll see on this left right arytenoid, here, this green-like lesion, and that's a retinoid chondritis. Now that horse needed some treatment. It's probably been there a while, but we did treat it for a few months with antibiotics and it did improve, but we're able to monitor that over time, which is just fabulous and just really makes things a lot easier. These horses often can present randomly, and sometimes it'd be inconsequential findings. If it's a racehorse, probably more of a worry. So yeah, we just tracked this one over time and you see it did improve. That's only 2 weeks later. So there you go. And that's it heading towards the end. It's improving even further and it's going quite well. So the other thing I want to talk about is roras for your performance horses. Now, warm bloods are a little bit overrepresented with this condition, I think. If you stand by the show jumping arena or the dressage arena, you'll hear them. They're quite noisy. This is left-sided rorar, most common sight. Quite an old video, I'm sorry. But you'll see here, it doesn't get full abduction. Now, you may not know, and this is something Ian probably wouldn't like me talking about, was Ian was one of the first surgeons to do a nerve graft. So instead of tying these back, he actually transplanted a nerve and re-innervated the throat. And that's been very successful for a lot of racehorses. I'm not sure Ian probably could comment whether he's done many performance horses yet for this condition, but I'd say probably not. Would that be fair, Ian?
Yeah, certainly not the numbers of racehorses, but we do a number of warm bloods because they don't want to take the risk of some of the complications of the tieback. So I think my last 2 nerve grafts have both been warm bloods. So there's certainly a lower numbers of what we do, but I have done quite a few over the years.
Yeah. So that's a great condition. Instead of tying it back, when you tie them back, they can often develop chronic coughing, aspiration, they aspirate the food, and it can be a bit of a pain to deal with. So some people have had it done in the past, and you've got the chronic nasal discharges and coughing, and that's not ideal. With the nerve graft, you don't get that. So it works really well. But the one presentation I'm saying with these warm bloods with upper respiratory tract problems is often they start to struggle, especially in dressage, when you start to ask for more collection and you're bringing the head up and you're flexing the neck. These horses start to struggle for air, and they can become resistant to collection and even start to reef the hands out of the rider. So it's something just to be aware of if that's coming along. So the ultrasound, I think Ian actually taught me this, in all fairness to him, was ultrasounding of the throat to assess whether it's suitable for a nerve graft or not. So if you've got a horse that's been chronically roaring and the muscles actually died off and atrophied, it's not a suitable candidate for the nerve graft. That's correct, Ian?
Yeah, once it's really heavily wasted, it takes a lot longer for the nerve graft to work. So by ultrasounding it, like you say, you can identify the size of the muscle, and if it's suitable, you can put a nerve in. If it's not suitable, you advise a tie back, and then people are doing the right surgery for their horse.
Yeah, so that's a good way to assess things. So the other thing I'm talking about ultrasound outside the normal of what we would normally use. This is technology fail here. This is a horse that had something injected outside the vein, and we're looking here for blood flow. So there's actually a clot in the jugular vein. This is the carotid artery below, and you had this big clot. So we often say to people, be careful when you're injecting jugulars. You can actually hit the carotid, and believe it or not, it's quite close. You'll only do it once, and yeah, so that's something we have to be careful of. So yeah, and then the next thing for me is pelvis. I ultrasound quite a lot of pelvises for suspected pelvis fractures, so it's really quite a simple way to pick this up. This horse ran into the box door and fractured the point of its hip, as a lot of people call it, but using the ultrasound was a really simple way to be assessed. So where else do I use my ultrasound machine? The other areas I quite like it is backs. So backs become a bit of a hot topic at the minute amongst dressage riders and performance horse people. All of a sudden we're being asked to x-ray backs as part of a pre-purchase assessment, which can be quite problematic, and we'll talk about that later. But often we'll use ultrasound to assess any changes in the interspinous ligaments. This horse presented with just mild resistance to work, and using the ultrasound, we could see these are his x-rays below. You can see there's a couple of vertebrae close, and this one here has got some changes on the insertion of the interspinous ligaments. That horse actually improved quite well with just changing his training and stretching that region, and it's been quite well, and I haven't had to do anything yet. So it's quite a useful way. Also joints, maybe not something we'd consider joints. I didn't have a great image of a joint capsule, but this is an insertional injury of a collateral ligament on a fetlock, a hind fetlock. The horse presented as an unwillingness to do lateral work suddenly, and there was a small swelling in the inside of the fetlock joint. So there's been some sort of trauma there that set this off, and we've got a collateral ligament injury. And then finally for the ultrasound, my sort of I like to do these. This is ultrasound guided injections. It's really quite a fun procedure. I have to be honest. I enjoy it. You just see the needle coming in here. This is sacroiliac, and I'm just trying to guide this under the pelvis. And believe it or not, you sometimes miss. It's the first time you do a sacroiliac injection, A, you're using a 10-inch needle, but B, you have to be pretty brave and you have to go deep. You think you're going to end up coming out the bottom of the horse, but you've got to aim down in there and get it in. So this is a really cool thing to do. And yeah, we do that quite often. A lot of warm bloods are presenting with sacroiliac dysfunction on the gut soreness in that region. So that's just some of the things we run through. Now, the x-rays, you'll see this in the field. Digital x-rays being a game changer, I think, for most equine vets. Instead of having to traipse back to the clinic, we're doing them in the field. We can do so much more. That's just all these x-rays we're taking in the field, different conditions, a tooth swelling, a horse with laminitis, trying to do a venogram to assess for any blood flow. You'll see there's no blood up here running through the dorsal part of the pedal bone. Unfortunately, this horse didn't have a great outcome. Another tooth, feet, stifles, penetrating wounds. It's a quick, and it's a very useful tool, even if we've got a horse that we're maybe considering we're going to send to MRI, to get a basic set of x-rays to start with is very useful. And it's not something you would ignore. So, okay. And so really quick, very cost effective, really, to be honest, and good screening tool. The cons of it, it is a static image. So it is just a snapshot in time. It's not showing activity. There might be some remodeling changes, and equally you can get artifacts. I've seen some artifacts, especially with feet and the pedal bones. This is a full, so it's a bit easier to see, but if you get sole defects, we often do have to remove the shoes. I'm sorry about that, but to get decent feet x-rays, it's often best to remove the shoes and trim the sole and get rid of any dead sole. And that's sometimes can be a bit painful for people and a bit annoying. So it's really simple. Some of the things we use it for, this is a penetrating wound. An interesting case, horse presented, the fourth horse to present in the farm with an abscess in the hind foot. And interestingly, they'd all been in the same paddock. And it turned out when we went looking with a metal detector, there was 38 star pickets that had been buried in the paddock. And so they brought an excavator in, and finally we got no more septic pedal bones. This is a septic pedal bone, and we had to dig the farm up. And the strange thing is that the guys that had owned the farm had been there 10 years, and they weren't there when they moved in. So do you know how old the star pickets were? So they've been driven into the ground, and this is penetrating. Your other things, your splint bones, a horse kicking in the float. This is what he did to himself, and healed quite well. Did well, and then your normal arthritis changes and stuff like that. So that's the x-rays. Have you got any questions? It was a quick run through. We've got a couple of questions actually. We've got one for Ian a bit later, maybe to explain the nerve graphs in detail. Someone's a bit interested in that there. And then someone just asked, how deep is the injection of the SI joint? Well, it's about 10 centimeters deep. It depends on the horse, how deep the horse is. So yeah, the big warm bloods, you need to use about 10 or 12-inch needle. And there's two different techniques. I'm not sure what Ian's technique is. I'll use the front approach. What's your approach, Ian?
You know, we do the same. I use the ultrasound to guide it under the wing of the pelvis. And if sometimes based on the bone scan results, we'll use a caudal approach as well to try and cover the whole joint. But the most common way is the way you do it. But it highlights that if you're not doing it with ultrasound, I think there's a lot of vets that will be missing it because you have no idea without the ultrasound. So you're exactly right. It has to be used.
Yeah. So I'm just going to stop sharing my screen, and Ian's going to share his screen. He's done a presentation, and there's been a couple of questions that we will answer later coming through. More suitable once Ian's done his thing. So. Okay. Let's just see. Excuse the tip. We're flying with technology here. It's often this doesn't happen. So I'll pass over to Ian now, and if you have got questions through the way, I'll collate them and I'll ask Ian for you.
Thanks very much, Mike. Appreciate the opportunity to be involved in your webinar, and it's the first one I've done via Zoom, so it's a bit exciting, and it's more exciting that there's people from all over the world listening, so it's fantastic. So Mike asked me to come along tonight and just explain a little bit more about bone scanning and MRI, and what I thought I might do is just give an idea of how we actually do it, because a lot of people that come, they drop their horses off and leave them with us in our care, but they don't actually, don't get to see the equipment. Now, unlike Mike, whose desire over the last few years is to downsize his equipment to get it nice and small to fit in his car, this diagnostic imaging equipment is just bigger and bigger. So they're quite large bits of equipment to get these special imaging techniques done. So if I can just get my get the slideshow happening here. There we go. So I'll start off with the bone scanner. The technical name is scintigraphy. It's a scintillation counter to count radiation as it comes off the horse. And step one, I'll just show you the equipment that we've got here at Ballarat. And this is a specific machine. It's the only machine built for horses specifically. It's made by a company in Germany called MIE, and they've got about 120 units around the world. And they refurbish human equipment, but they've built this amazing structure that we can manipulate the equipment to suit the horse. So to just outline here, this large block here is the camera, and that weighs 250 kilograms. And we have to be able to lift it way up above the horse and way down to the side of the horse and turn it in all sorts of different angles. And so it's quite a unique bit of engineering that we can do all of this almost silently so that we don't upset the horse. We've had this bone scanner in Ballarat for 11 years now, and serviced twice yearly. The German engineer comes over, which is quite an expense to have the service contract, but in 11 years, we've only been out of action for 2 weeks because we feel that the service they give us is so good. Now, the big thing about the bone scanner is it can scan all bones in the horse. So when Mike wants to look at lots of different areas in the horse, he's got to take a lot of x-rays, but we can do from the tip of the nose to the tip of the tail down to the feet what we call a whole body bone scan if we have to. Now, it only shows bone of significance when we're looking for injuries to the bone. And I'll show some examples of that soon. But the process itself is we inject the horse with a radioactive liquid called technetium. And we have to get that delivered each morning from a laboratory in Melbourne and inject it. And then we have to wait 2 hours for that radioactive material to soak up into the bones. So as soon as you inject the horse, it becomes radioactive. And so people can't stand with that horse for long periods of time. And so that's why none of the clients can be with their horses when we're doing a bone scan, because of the radiation safety issues. And as healthcare workers, we are allowed to work with radioactive materials, but it's strictly controlled by the Department of Health. So we do have to keep a log of all the radiation we use and how we deal with the waste because it's excreted in the urine. So we inject the horse and we pop them back in a special box. They usually stay in those boxes overnight. They're heated, so the horse is really warm and it's got a lot of blood vessel dilation right down to the feet, so that we know that this radioactive dye will get to all areas of the bone. And it is one of the problems with warm blood horses. They seem to not distribute it quite as well as some of the thoroughbreds, and especially in cold weather. So Ballarat is not the ideal position for a really good bone scanner, but we got over that because we heat the boxes. There's 3 purpose-built bone scan boxes. They're lead lined, so the radiation's not going outside the building, and they're heated to keep the horses at a nice 21 degrees all the time. The camera itself, if you turn the heater off, the crystals inside the camera that take the images will fracture. So we have to keep that room at 21 degrees all year round. So it's quite a sort of extensive both cost and technology to run the scanner. So, as I said, we can do anywhere we like, and this particular scanner has a worm screw up the centre here, and we can lift this 250 kilo head and position it wherever we like. So this one is, we're taking an image of the lumbar spine along here, and so we need the camera in a special position where it's sort of looking in 45 degrees to the edge of the spine in that lumbar area. And if we just have a look here, so if I put the skeleton there, that gives you an idea of the bone structures that we're looking at when the camera's in that view. The horses are sedated, not excessively heavily, because if you give them too much sedation, they start to wobble or get a bit unsteady on their feet. And each image that we capture to get the diagnosis takes 90 seconds to collect. So the camera sits in that position for 90 seconds, and the radiation coming off from the horse is collected into that camera, and then through a series of amazing digital technology, it is then created into an image, which I'll show you now. So this is a lumbar spine view, and probably the easiest thing to recognise are the ribs running down here, the rib cage, and this large structure is the kidney. And the kidney is the only soft tissue structure that we see, apart from the bladder, because the technetium is excreted in the urine, and it's really quite dangerous. You don't want to get urine on you, because then you'll get a large dose of radiation. So that also adds to the technique of getting these bone scans. If the horses want to urinate while they're in the scintigraphy room, we have to catch that in a bucket and keep it protected behind lead for 24 hours. So it's just another little difficulty that we deal with. So in this particular horse, there's a stress fracture of the lamina of the fourth lumbar vertebra, and the skeleton over here shows the lumbar vertebra have these wide short ribs, as they're called, and this structure here is a sort of the roof of the spinal canal, and that's where this stress fracture has occurred. And this horse was a warm blood, and its presenting signs were pig rooting, tendency to buck, and certainly not moving well or not collecting itself well when going forward. So, and this is an area it's not impossible to radiograph, but it's very difficult to radiograph and find the detail that you need. So it's one area that the bone scan is really useful. Now, if we put the bone scanner right above the top of the horse, we can find, and this is the same horse, that it's only on one side that it's injured. Again, over here, we're looking down on the skeleton, and it's this little piece of bone here where there's a stress fracture. So the outcome for this horse can be quite good, because stress fractures heal really well, provided they don't produce a large callus, which can interfere with the nerves coming out from the side of the spinal cord. But this horse did really well with just 4 months rest, repeat bone scan, and it was back in work. Now, another area which in a large adult horse is almost, again, impossible to get high quality diagnostic radiographs is the pelvis. And so in this case, we have to have the camera right up above the top of the horse, and obviously 250 kilo camera, we don't want it to drop down onto the horse. So we have great faith in our German technology of the hoist. And this particular little box down here, that's where all the computer is housed. And this whole unit is actually floating about 1 centimetre above the floor. And we can move it on these big rails up the top. We can go front to back, side to side. So it makes it really easy to move the camera around without having to move the horse. So when we're in this position, we can look at not only the pelvis, but importantly the sacroiliac joints, which Mike was showing the injections of before. And again, we'll put the skeleton there. We can see that we're looking directly down onto the wing of the pelvis, the ilium, and the sacroiliac joints are just in this area here. So I'll give you an example of that. So in this case, the left side of the pelvis and the right side of the pelvis. Over here on this screen is the skeleton, and in the red ink is the zone where the sacroiliac joint exists on the bottom surface of that bone. So you'd be looking through onto the sacroiliac joint. And where we get this increased amount of technetium, which is the black shadows, that's when there's bone injury. So when a bone is injured, it has a particular cell type and the technetium binds to that cell type. So we know that there's an increased uptake, and it can represent anything from a fracture, if it's really severe or a very intense uptake, or it could be a bruise in the bone. It can be where a ligament attaches to the bone and is tried to pull out, and that's sort of what's happening in that situation here, although this could almost approach a non-displaced fracture in the ilium, but it most likely represents tearing of the ligaments away from the bone. So it's really the only way to accurately diagnose the severity of SI joint disease. And it's really easy to have a clinical opinion on your palpations that you've got pain when you palpate the horses around this area, but it's really hard to delineate accurately which bits are involved. And so the bone scanner really helps. These two views here are, again, the camera's been placed at an angle to look down into the sacroiliac joints, and we can see increased uptake, this darker patch here and this darker patch over here. This is probably one time to just explain that you might be wondering what this really dark spot is over here. Now that's completely normal. It's the top of the wing of the pelvis, and there's very little soft tissue over the top of that bone. And so it's a lot closer to the camera, so you get a lot more radiation coming out of that piece of bone. And so our art form is to know which bits are normal, such as these two here, because there's no soft tissue covering. But when you come to this area, that's about 15 centimetres under the skin. So the radiation's got to travel a lot further before the camera can detect it. So some images, you'd be thinking that this might be the real lesion here, but we know it's over here. Now, another area that's, again, this one's quite easy to radiograph, but the radiographs can be really hard to interpret because of the shape of the bones, and that's the neck. And as Mike knows, warm blood, dressage horses, eventers, as well as racing horses, lots of them can have neck problems. So in this case, we have the camera vertical, standing the horse, and we just bring the camera in as close as we can to get to the side of the horse. And then we're getting a representation. We can get this whole lower neck, and if we want to, we can move the camera forward to get the upper vertebrae. So, and sometimes, or most of the time, we'll also put the camera underneath, looking up right from underneath here, so we can look at both sides of the neck vertebra at the same time. Now, if we look at a neck image, this is a horse from the left-hand side, and the sort of light area down here is where the spinal cord runs, and these areas here are known as facet joints, and they're what allow the horse to move the neck so extensively in all directions. And in real life, they're a big disc, two discs rubbing against each other. They've got synovial fluid in them. They can slide, they can rotate, and that allows the horse to do everything you need it to do. but often you can get arthritis in these joints, and especially lower down in the neck. And in this particular one here, it's quite a large and what we call a shape change. If you compare it to the one in front and the one behind, they should all look about the same, but this one's really large. And so even though it hasn't got a really high uptake of technetium, really dark black, the shape of that bone tells us that there's something wrong, and then we would go and specifically x-ray that area to try and see how severe the injury or the arthritic change may be. So that's sort of three areas that we frequently look at with the bone scanner. Obviously, with racehorses, we're probably doing more lower limb work, but we do see a lot of back injuries, a lot of stress fractures in racehorses as well. And when the horses come to the hospital, we try to limit the bone scan to one half or the other. To do a full body bone scan can take anything up to 2.5, 3 hours sometimes to get all the images, because if the horses move a lot, you have to keep retaking the images. If we're just doing the front legs, we don't always have to take the front shoes off, but if we're doing the back legs, because of where we position the camera, we'll frequently take the shoes off in case the horse wants to kick the camera, as it's a fairly expensive unit to replace. And they have to fly another one out from Germany, 250 kilo head. So touch wood, we haven't had a broken camera yet. So a lot of the horses, we don't have to take shoes off, especially if we're only interested in the back or the neck. And that'll often happen if, referring vets like Mike ring me up and he'll say, we just need to look at the back of this horse. We've ruled out all the lower limbs, and so we'll just bone scan the back, and that is cheaper than doing the whole body. Oh, lost the screen there. So now, Mike, do you want to...
Before you head on, I've just got an interesting question.
Yep.
It's just come in from Jeremy. With CT available, can you, and I'll probably leave it to you, you're probably more ahead of this, CT versus scintigraphy, just what's the differences and just the basic well, I know I'll explain. One of the issues with CT is they've got to get into a tube, and we can't fit horses in above the University of Melbourne's a standing machine, so you don't have to do general anesthetic. And I think they said this morning they can only go as high as the corpus or the hock, can't get much further. And I know I've tried to refer some necks for CT images, and we can't get past the second vertebra or third vertebra, especially in a big warm blood, because the horse's head's got to go through a tube. And I think that's one of the big issues. But can you, Ian, do you mind explaining what sort of the differences between the two and where you see the place for CT versus scintigraphy?
Yep. CT, which is computed tomography, is a really advanced radiology system where you take multiple x-rays spinning around a part of the body, and then the computer puts all of those x-rays together, and it can provide both the flat two-dimensional film that we're used to seeing as a slice, a very thin slice, or it can actually reconstruct the three-dimensional anatomy of the bone, which is really useful in fractures. So the CT, there's two types. You can do CT as a standing, which is very new. Melbourne University is the only one in Australia with one so far, but it is limited to the knee and the hock down to the ground because it's the horse is standing. And there's a lot of CT units around the world where they use general anaesthesia, and some they can do standing where you can put the head and, like Mike said, the neck. In Germany, there's machines that you can actually get the horses stifle into, again, under general anaesthetic. It's quite a big task. The horses are anaesthetised, legs are spread apart and pulled through the tube or the donut. And then they have to go through a recovery from a general anaesthetic. And so that's where the standing units are trying to advance themselves to avoid the need for general anaesthesia, and hence the same with standing MRI. I think that the biggest advantage of CT units is, one is fracture repair, if you have a lower limb fracture in a horse and you had the ability to CT scan the horse prior to surgery, which a lot of people, not a lot, but some people have that ability, it really helps with how you repair that fracture surgically. So that's one of the biggest uses. The second is the head. You can put a head through a CT machine and get this amazing three-dimensional reconstruction. You can see all the anatomy of the bones and the tooth root issues or fractures, as well as the individual slices. And so heads are one thing where CT is way ahead of scintigraphy on. But probably again, where the scintigraphy unit sort of shines is the backbone, the whole neck, and the ability to do every bone in the body in a relatively quick manner without having to anaesthetise the horse. So the CT won't be able to look at the pelvis, CT can't look at the elbow and the shoulder. And so while you get really crisp, beautiful images with the CT, it doesn't tell you about the metabolic activity. And that's where the bone scanner can say where there's active bone injury. When you've broken your splint bone and you've got a big lump and it's a big callus, is it still painful or not? And lots of people come with those big lumps on their legs and say, oh, no, it's been there for ages. It's not bothering. It's been there for ages. You do the bone scan and that lump comes up black. And that means it is still actively inflamed and it's still painful. So there is, each modality has their own benefits. The CT units are much more expensive to install, but you know, you pick your cases. And if I had a horse with a real head problem, I'd be ordering up a CT for sure.
Yep, thank you. And then just one final question regarding the scintigraphy. Someone just asked a question: does the bone scanner emit radiation, or is it just the technetium?
It's just the technetium.
Yep.
So the horses get injected with a dose of technetium that is quantified by the lab in Melbourne, and it has what we call a half-life, and that is that every so often the amount of radiation drops by half, and the half-life of technetium is such that within 24 hours of injecting it, the horse is safe to be handled by anybody. The urine, on the other hand, takes 48 hours because there's a super concentration in the urine. And so we'll take the horse out of the box the next morning and happily send it home or start to doing some work on it. But we don't clean the box out for another 24 hours so that our staff are not exposed to the radiation from the bedding. So it's just the horse that's radioactive.
Thank you very much, Ian. I think we can let you get on with your big toy, your proper toy.